Welcome, everybody. Thank you so much for joining us for today's webinar, Introduction to Expanding School Medicaid Programs. We're excited you all could join us and appreciate you taking the time to participate in today's webinar. My name is Alex Mays, and I'm the National Program Director at Healthy Schools Campaign, which is the organization that's hosting today's webinar. Before we get started with our content today, I just wanted to walk through a few quick logistics for how today's webinar is going to run. The webinar will go for approximately an hour, and we will have a recording of the webinar available along with today's slides. We'll send those out via email later this week, so look out for that email, which will have a link to both the slides and the recording. There's also a very short survey at the end of the webinar, which we would really appreciate you providing feedback through. We're going to save the last 15 minutes or so at the end of the webinar for question and answer session with our speakers. And you can send in questions throughout the webinar by typing them into the questions box on your control panel and just clicking that send button. So feel free to send in those questions throughout the webinar and throughout the presentations, and we'll collect them and then be sure to get them at the end of the webinar. Next slide, please. So today's webinar is really going to be, just as the title says, an introduction to expanding school Medicaid programs. This is really going to be a 101 on school Medicaid. And what we hope that you'll walk away with at the end of the day is a better understanding of just what Medicaid is and what it covers, both in and out of schools, and to really provide you all with an overview of a specific opportunity for expanding school-based Medicaid programs, which is known as the free care policy reversal. And then we'll also be sharing progress that states have been making and leveraging this opportunity to expand their school-based Medicaid programs. And we're thrilled to have two of our very close partners with us, Donna Mazik from the National Association of School Nurses and Sasha Podolsky from AASA, the School Superintendents Association, who will be discussing the importance of school-based Medicaid for various stakeholders and really how you all can get involved in this work. Next slide, please. So again, this is our lineup of speakers for today. We will kick things off with Lena O'Rourke, who's presenting on behalf of Healthy Schools Campaign, and then Sasha from AASA. Then I'll be sharing some content, and then followed by Donna from National Association of School Nurses. We are thrilled you all are participating in this webinar at Healthy Schools Campaign. Expanding access to school health services through Medicaid is a core focus of our work, and there's been tremendous momentum really over the last 5 years, but especially in the last year around looking at how to leverage school Medicaid to really expand access to care in schools and support both children's health and learning. So we're excited to be digging in today with you all with this content. And I will now introduce our first speaker, who is Lena O'Rourke. And Lena is the founder and principal at O'Rourke Health Policy Strategies. She's an experienced healthcare advocate, and her work specializes in legislative and regulatory strategy around Medicaid. We've had the pleasure of working with her at Healthy Schools Campaign, supporting our work around expanding access to Medicaid-funded school health services for the last 3 years. And we're thrilled to have her on today's webinar, and she is going to kick us off with an overview of Medicaid and the free care policy reversal. So Lena, I will hand it over to you.
Thank you so much, Alex, and thank you so much to all of you for joining today. I think I have the most straightforward job, which is giving the background on what Medicaid is and the role it plays in school health services. So at its core, Medicaid is health insurance. And in some states, this is important, Medicaid is called different things. So for example, it's called Medi-Cal in California or CanCare in Kansas. But it is the health insurance program broadly that covers 1 in 5 people in the United States, including about 37 million children. That's 40% of all kids in the US. Medicaid's sister program, the Children's Health Insurance Program, or CHIP, covers an additional 8.9 million children. And for the low-income families whose kids are covered by Medicaid and CHIP, coverage is comprehensive and affordable because Medicaid keeps out-of-pocket spending low, and it has a benefits package that is designed specifically with kids' healthcare needs in mind, looking at the physical and behavioral health services that children and adolescents really need. So it's really comprehensive and robust. Medicaid eligibility varies by state. States have a lot of flexibility in who is eligible, but 49 states, including DC, cover kids at least up to 200% of poverty. And many states go way above that. 19 states cover kids up to 300% of poverty. Only 2 states limit kids' eligibility below 200%. So it has broad and deep coverage for a number of low-income and working families. Next slide, please. It is important to know that Medicaid is a partnership between the federal government and your state. And the federal government and your state's Medicaid program share the total costs of providing services to the beneficiaries, to the people who get the healthcare services. States have a tremendous amount of flexibility to design their program, but within certain federal parameters. So states decide the eligibility levels, the administration of the program, and what the federal benefit, or excuse me, what the benefit package looks like. But then federal Medicaid signs off on the state choices. So in that way, it's a really strong check and balance with a lot of state autonomy in how it's structured. The program itself is governed by a written plan. It's called the State Medicaid Plan. That document's written by the state, and it is approved by HHS. It is an interesting part of Medicaid, what an ever-changing program it is. It continuously adapts to really meet the needs of the state, to meet the needs of the state population and the priorities of any given administration and what the people in the state need and in terms of their health care. It is a relatively straightforward process to modify the Medicaid program. It's not necessarily easy or quick, but it's straightforward. And changes are made through what are called state plan amendments. That is one way you can change your state Medicaid plan. As a result of this partnership and as a result of the nature of the changes, every state's Medicaid program is really unique. So do remember that as we go forward, that once you've seen one Medicaid program, you've seen one Medicaid program. But what we're talking about today are trends across the country. So there's a lot we can still lift up even though your program will be unique. Next slide, please. Now, Medicaid has played a really big role in school health for more than 30 years. Almost all states have a school-based Medicaid program. And every state's school-based Medicaid program is different and unique. But in general, Medicaid pays for eligible school health services that are included in a student's individualized education plan, IEP, or in an individualized family services plan, an ISFP, or for some services covered by the Maternal and Child Health Block Grant. As 14% of public school children have IEPs, this means Medicaid can go quite deep into the school health services and does cover a lot of kids who are already in schools. In fact, in 2015, Medicaid paid for, 2015 is the year for which, the most recent year for which data is available. Medicaid paid for nearly $4 billion in school-based healthcare services. By comparison, schools received about $12 billion in federal IDEA funding that same year. And so it's a significant amount of money for schools, but it really, in terms of overall Medicaid spending, it's only about 1% of total Medicaid spending. So again, it's a lot of money coming into the schools to support and to really deliver healthcare services for Medicaid enrolled kids. Not a lot off the top of Medicaid. Next slide, please. Now, to reiterate, Medicaid has historically only reimbursed for the services that are in a limited number of situations like the IEPs. And that is a really important source of funding and has been well invested in to help students, to help the Medicaid enrolled students with IEPs, IFSPs, and the Maternal and Child Health Block Grant. But it was restricted to that group of students. Then in 2014, CMS made a policy clarification that removed that barrier for school-based Medicaid. And they clarified that schools can be reimbursed for all Medicaid, for the services provided to all Medicaid enrolled students. And this is what we're here to talk about, is this policy clarification, which is referred to as the free care policy reversal. Next slide, please. This 2014 change, again, it reversed the long-standing tradition of only reimbursing for students for health and behavioral health services provided to Medicaid enrolled kids with an IEP. Now, CMS allows states a lot more flexibility in their their school-based Medicaid programs. By allowing states to reimburse for services provided to all Medicaid enrolled students, it's a tremendous opportunity to expand school health services. But work has to be done to get to that point. It's not an automatic choice. States have to decide to expand their school-based Medicaid programs to bill for all Medicaid enrolled students. Lots of different stakeholders are engaged in that process, not the least of which are the state Medicaid departments, the Department of Education, in some cases, the governor, the state legislature, superintendents, providers in the various LEAs, like the school nurses. All of these different stakeholders can come together to advance the agenda to expand under this free care policy reversal. And then make a decision on whether or not they will expand. Once a state has decided to expand or not, it has to look at its existing Medicaid plan, see if it needs to remove any restrictive language, which could result in the need to submit a state plan amendment or a SPA. Some states will not need to change their state Medicaid plan. Again, because every state's program is unique, it will depend on the state, but there is a process by which you can expand Medicaid, the school-based Medicaid programs to all Medicaid enrolled students. That's, again, what we're going to be digging into here more over this hour. Next slide, please. But what does it mean? Why do we care? Why are people even having this conversation? It's because there's a lot of opportunity. It's not a technical Medicaid fix. It's an opportunity to expand school-based Medicaid to more students, which might increase the amount of federal funding to the state to support school health. So it is a potentially big and sustainable source of revenue, new revenue, to the state and then in turn to schools to help stretch their school health budget further. But it's more than that too. It allows state Medicaid and education policymakers to think more holistically about meeting student need and thinking about what services have unmet need, what their student population really needs, supporting the workforce who is providing the services to the students, and looking at the entire school health services program in terms of how Medicaid can really support and bolster the existing programs and fill in other needs. And the additional Medicaid funding makes a lot of those conversations happen and possible. So with that, Alex, I will turn back to you so we can go into a little bit more detail about what this means and where we're going.
Great. Thank you so much, Lena, for that overview and opening remarks. It's extremely helpful to have that foundation to kick things off on. So I'm going to hand it over to our next speaker, Sasha Podelsky, who's with AASA. Sasha is the Assistant Director of Policy and Advocacy for AASA and has been with the organization since 2010. In her role, she focuses on federal education issues pertaining to vouchers, special education, rural schools, English language learners, homeless and foster care youth, and other vulnerable populations. In 2017, Sasha wrote Cutting Medicaid, Prescription to Hurt the Neediest Children, which was featured multiple times in press coverage by Edweek and Politico, as well as quoted in New York Times, Washington Post, and in PBS NewsHour. Sasha has been just a tremendous advocate and partner in this work, both in terms of raising visibility around school Medicaid and also in helping the field think how to communicate about the potential impact of this work to educators and others. So we are thrilled to have Sasha with us today to share a little bit more about why school Medicaid is important from her perspective and how the potential impact for school administrators. So Sasha, I will hand it over to you now.
Great, thank you. Next, okay, great. So as was mentioned before, Medicaid is an incredibly important funding stream for school districts. It's actually the third largest federal funding stream that school districts receive after Title I and IDEA funding. It's estimated that funding could be anywhere between $4 and $5 billion. In 2016, it was about $4.5 billion. And while that is a lot of money for districts, that you have to consider that those are dollars that not every district is receiving, because not every district participates in the Medicaid program. So that amount could be a lot more. But even if it was, say, $6 billion or $7 billion, we're talking about a percentage in terms of Medicare spending that would be roughly less than 1% or less than 1% of all Medicaid spending. So it's very meaningful money to education, but not very much money when it comes to healthcare costs overall and expenses. And the reason why Medicaid in schools is such an important program is that 1 in 3 school-age children rely on Medicaid to meet their basic health needs. And since children spend most of their time at school, it makes sense to deliver healthcare services in the place where they spend most of their time. And particularly when districts can get healthcare dollars to reimburse them for these healthcare expenses, Medicaid becomes a really important funding stream for them. Because that way they don't have to utilize local education funding necessarily to pay for these healthcare services that kids need. There are several different ways that schools can get access to Medicaid reimbursement. They can do that by providing actually direct medical or health-related services to children who are eligible for Medicaid. They can perform administrative activities in support of the state Medicaid plan. For example, they can do enrollment activities. We know a lot of school districts take the time, for example, when a kid is coming in to their school to ask, okay, do you have vaccination records, for example? If the answer is no, that could be a sign that that child has not been to a doctor recently and maybe doesn't have access to health care. So that sends a signal to someone at the front office or to the school nurse or whoever's doing the intake that perhaps this is a good opportunity to try and connect that kid with Medicaid coverage and their family, for that matter, as well. So that's just one of the administrative activities that we can get reimbursement from the state for doing. Or some districts are in a position where they can actually claim both the administrative side as well as what we call the direct service, the actual health-related services that we're providing to children. Next slide. And as was mentioned, since 1988, Medicaid has permitted school districts to bill for certain medically necessary services that they provide to special education students who have IEPs. And while this can differ based on what is allowable under the state plan, most of these services that are allowed include audiology services, nursing services, speech-language pathology services, occupational and physical therapy, personal nursing, and mental health services. Those are the ones that are almost universal, I would say, in terms of reimbursement for districts. And this is really important because a lot of these services are written into children's IEPs, or individualized education plans. And when a child receives special education services, they also receive this IEP, or individualized education plan, which allows them to, which tells the school personnel a lot of information about the child and their needs and what they're good at and what they need help with. And part of that dictates what kinds of services that they need in order to learn alongside their peers. And so Medicaid is a critical funding stream for districts in the sense that when we don't receive the funding that we should be receiving under IDEA, Medicaid is critical in supplementing that funding stream so that districts can continue to offer the wide variety of special education services and the quality of special education services that they need to under the law. Next slide, please. So in 2017, we issued this report that Alex mentioned, Cutting Medicaid, a prescription to hurt the neediest children, because we were very concerned about the Republicans' proposal on Capitol Hill to block grant the Medicaid program. And we wanted to have a better sense of how districts were utilizing the Medicaid reimbursement they receive. So once they claim for Medicaid, whether it's for the direct services they're providing or the administrative services that they're doing, what do they use those Medicaid dollars for? What happens when they come back to the district? And what we found is that 2/3 of districts reinvest that Medicaid funding back into the salaries for the health professionals and services that they need to provide students. Some districts also use that money to expand health-related services. So whether that means, doing checks, universal screenings, for example, for kids in the school building, related to lead or related to asthma or diabetes. Those are just a few examples of how they may be trying to expand health-related services that they offer. Certainly mental health services is an area where we see a lot of districts trying to expand services to kids. About 40% of districts use the money more on the administrative side, so facilitating the outreach and coordination of services to get kids connected to schools. So, for example, we notice the kid is having trouble with their teeth. We can connect them with a dentist in the area who can make sure that everything's okay and give them a checkup, and we can get reimbursement for that. And then 26% said that while they may use it for salaries and for these other things, they may also use it for something else. And that typically were things like paying for really expensive equipment that they may need to purchase for particularly high-need students in their districts. Next slide, please. And in terms of how they get reimbursement, there's two different processes that states use. There's what's called fee-for-service, and then there's a cost-based reimbursement system. So for fee-for-service, what happens is the state establishes a Medicaid reimbursement rate for each additional service, each billable service. And it's based on factors like what is the cost of providing the service, a review of what other entities pay in the private market, and a percentage of what Medicare pays for those services. And so fee-for-service is not an easy system to navigate, but it is a system that some states are still using. The other system is cost-based reimbursement. This is when schools receive interim payments during the year from the state Medicaid agency that are based on the cost the school district estimates they're going to incur to deliver Medicaid-eligible services. And so at the end of the school year, the district calculates what their costs were that they delivered and how those compare with the payments they got during the year, and they kind of reconcile them to get their final allocation. Next slide, please. And this is a lot of paperwork that schools have to do in either scenario. And the reason why they do this paperwork, they go through this Medicaid claiming process, the reason why they ask their providers to do this is that we know when kids come to school with unmet health needs, they struggle to learn. To put it simply, sick kids can't learn. And we have an obligation ultimately, not as healthcare providers, but as educators, to make sure that we are meeting that basic function, that we are making sure that kids are able to graduate college and career ready. And so if there are health issues that are preventing them from learning, we need to address them if they impact their education. Another reason why I would participate in the Medicaid program is because of just inadequate funding levels at the local and state level that just prevent us from giving kids the health-related services that they need. So Medicaid, again, is this really important funding stream that swoops in it and supplements some of that funding that we're not getting elsewhere. As I mentioned before, IDEA funding is rather inadequate, and so Medicaid also helps to supplement this funding stream so we can deliver special education services to kids that we're required to by law. And again, Medicaid funding that supports just one position, like the school nurse, for example, doesn't just benefit the Medicaid eligible students that we serve. It benefits every child. It's not like the school nurse, when she sees a child, walks in and says, okay, I can take your temperature if you're Medicaid eligible, but I can't if you're not. I mean, the fact that we're able to fund these positions that through Medicaid that benefit every child and every person in the school building, for that matter, is really beneficial and helpful and important. Next slide, please. So what we tried to analyze recently by doing a survey this past December was why some districts don't participate. And what was causing that? Because it seems like to us that this is money on the table for them to pull down and expand healthcare services for kids, or increase healthcare services for kids, or supplement the funding that they're not getting from elsewhere in order to deliver healthcare services. And we were concerned that we were hearing from districts anecdotally that were really, telling us, my goodness, we have a mental health crisis in our schools, or, we really have so many kids who are impacted by the opiate epidemic in our schools, but we have no way of serving them, or it's very difficult to serve them, we have no funding. And we tried to kind of figure out what's going on here. Why are these districts not participating in the Medicaid program and using some of that funding to supplement so that they can do a better job of meeting these healthcare needs for kids? And what we found was that paperwork was a major barrier. The districts that surveyed, that we asked, why don't you participate? Many small districts, those with less than 1,000 students and those that are identified as rural, indicated that they don't participate in the program, primarily because of the paperwork piece. And a third of districts said that complying with paperwork and administrative requirements related to Medicaid was specifically why they did not, or that they had lost money because of the fact that they had because of how expensive it was to complete it. So this claiming piece is not easy for districts to do, but at the same time, this money is very, very valuable, and if they can figure out a way of doing it, it's an incredibly useful resource that makes a difference in terms of the services that they can provide to kids and the professionals that they can hire. Next slide. So I guess the final analysis for me would be that, Medicaid plays an absolutely critical role for schools. We just need to keep looking for ways to improve it and make it easier and more beneficial for states and districts to participate. And certainly the opportunities presented by the free care reversal, allows states and districts a wonderful opportunity to deliver more healthcare services to more kids. And we're hopeful that with additional changes, we can see the Medicaid program grow in many places, and also become more streamlined, so the districts can really access these funds regardless of how large they may be or what their administrative capacity may be. Next slide. And so I would urge those of you who engage with school leaders to really emphasize the power of this program, how participating in the Medicaid program enables healthcare dollars to be used for healthcare services, which allows them to then use their education dollars on education services. I mean, there were always going to dilute education dollars for healthcare services. And Medicaid will never do a full job of paying for all those costs, but certainly, it will be incredibly helpful, and it will allow us to do our primary mission, which is, of course, to spend money on education, if we can use Medicaid as a funding stream. Secondly, sick kids can't learn. I like to say we can't have educational equity if we don't have healthcare equity in our schools. So it's impossible to close that educational equity gap if we have kids who come to school and they can't see the chalkboard, or they can't hear the teacher, or they're coming from, they're in crisis and they need to speak with someone and receive mental health services. Finally, I would say that there's a great educational argument and education policy argument for investing in the Medicaid program and what it takes to claim under Medicaid, which is that many states are requiring schools, as a result of the recently passed Every Student Succeeds Act, to address how they are going to reduce chronic absenteeism in school districts. And we know, of course, that kids miss school when they are sick and have chronic health conditions. And so one way that we like to point to that can be achieved is by improving access to healthcare services in schools. And pulling down resources from Medicaid is a great way of doing that. It's a great way of again, meeting the healthcare commitments of kids generally, but also of addressing this educational data point that's becoming increasingly important in state education policy, which is reducing the rate of chronic absenteeism. So with that, I will turn things back over to Alex.
Great. Thank you so much, Sasha, for that wonderful overview and sharing the really interesting results from the survey and work that AASA has done. I think that's incredibly helpful perspective and context to provide to this conversation. So I now want to take a little bit of time to share with everybody what we're seeing in terms of state level activity around leveraging this new opportunity, the free care policy reversal, to expand access to Medicaid funded school health services. So next slide, please. So you've heard about what Medicaid is and the important role that it really plays in supporting school health services. And so we really want to build on that and share both where state level activity is in moving this opportunity forward, and speak a little bit about steps that you all can take to explore this opportunity in your states. So just to recap, so as a result of the free care policy reversal that happened at the end of 2014, states now have the option to cover all Medicaid enrolled students in schools and give school districts the ability to seek Medicaid reimbursement for any Medicaid eligible service delivered to a Medicaid enrolled kid. So Medicaid will pay for services specifically if the student is enrolled in Medicaid. If the services provided are covered by the state, we heard a lot about the state Medicaid plan. And so if those services are in that state Medicaid plan, and if the services are delivered by a qualified provider, and if the state has appropriate billing documentation oversight mechanisms in place. But assuming those criteria are met, then Medicaid can pay for those services delivered in a school environment. As we shared, next slide, please, states, while this was a change that happened from Centers for Medicare Medicaid Services, many states need to make changes to their state Medicaid plans, or in a limited number of situations to their state legislation to implement this change. And again, as Lena said, changing a state Medicaid plan is not an insurmountable barrier by any means. These are meant to be living documents. They're changed very frequently, but it is an additional step that states need to take in order to really leverage this opportunity. So states can choose to leverage this opportunity and expand their school-based Medicaid programs, which is a huge opportunity in terms of a new and sustainable source of revenue from the federal government for services being provided to students. One point that I think is really important to emphasize is that this is also a key opportunity for states, I think, to really take a step back and think about opportunities to also look at who Medicaid eligible providers are in the schools that are delivering these services and what the covered services are. So as you go through the process of thinking about changing your state Medicaid plan, it's a really good chance to think about, are there providers that we know that are delivering services within these schools that we wish could be billing Medicaid for these services? And then using this process of changing state guidance and potentially a state Medicaid plan to also allow those additional providers and services to be reimbursable. And I'll speak a little bit how we've seen that unfold in some states, but a number of states, for example, are really looking at this as a chance to add additional behavioral health providers, such as school psychologists or school social workers, or even looking at services that could be added. North Carolina is a state that moved forward with implementing the free care policy reversal, and they used as a chance to add vision services as an example. So that was a category of services that they previously could not bill Medicaid for if they were delivered in schools, and now as a result of this change, they can. Next slide, please. So right now we're in the situation that many states are actively considering expanding their school-based Medicaid programs, which is why we're really excited to do today's webinar and highlight this opportunity for you all so you can think about ways in which you might be able to engage with your state and then in turn support implementation at the district level. The change happened in free care policy reversal happened at the end of 2014, and it took a little bit of time, I think, for states to really wrap their head around what this opportunity was and understand how it could be leveraged and implemented. And so it's really been in the last year or so that we've seen a lot of momentum building around this and a lot of conversations happening at the state and district levels around expanding school-based Medicaid programs and looking at leveraging this free care policy reversal to enable districts to bill Medicaid for all Medicaid eligible services delivered within the general student population to Medicaid enrolled kids. Again, there are a lot of different approaches that states are taking to this and different models you can consider for moving it forward. Some states are looking at taking a very broad approach and again, looking at adding additional providers and services and making other changes to the program, where some states are just taking a narrower approach and looking at allowing just one specific provider group, such as school nurses, to be able to bill Medicaid for services. And so those are reflective of the uniqueness of each state's existing program, but just to highlight, there's a lot of different ways in which this can be moved forward. I do also want to highlight that the current administration has been actively working with states that are considering expanding their school-based Medicaid and has been approving these requests to change state Medicaid plans to expand school-based Medicaid programs. So I think that's a question we commonly get asked about whether or not the administration has been supportive of these changes, and they have been. We've seen a number of state plan amendments approved and a number in the pipeline that likely will be getting approved this year. Next slide, please. So we just want to highlight a little bit of the state activity that's been happening around implementation of the free care policy reversal. So what this chart highlights is that state level activity, but I think it also highlights just that there is no one size fits all approach to this. You'll see some states are pursuing legislative changes to get this up and off the ground, whereas others are just doing the state plan amendments. I'll walk through some of these examples, but I will say that this chart is pulled from a longer brief that goes into a lot more detail that's linked at the end of my slides if you're interested in digging into this more. So 5 states have had state plan amendments approved to implement the free care policy reversal: Florida, Louisiana, Massachusetts, Michigan, and North Carolina. Florida is a little unique in that they also had the free care policy included within their state statute. And so in order to actually implement it and allow school districts within Florida to bill Medicaid under this change, they have to also change their state statute, which they're working on. But as a result, Florida hasn't actually implemented this. Louisiana was the first state to make this change. They just did it for school nurses, and so they made the change in 2015. And so in Louisiana, for the past 3+ years, school districts have been able to bill for school nursing services delivered to Medicaid enrolled kids. And then Massachusetts, Michigan, and North Carolina have happened more recently. Massachusetts and Michigan are really nice examples in terms of states that have taken broader approaches to this change and really looked at recognizing schools as another site of service for delivering services and allowing eligible providers to be delivering for any medically necessary service. I'll talk a little bit more about Michigan in a moment, but they also really took it as an opportunity to add a number of additional providers that are delivering services within their schools. And I mentioned North Carolina added vision services as well. Missouri and South Carolina have also implemented this. South Carolina did it on the earlier end as well. These states did not need to change their state plan, Medicaid plan. There are a number of states that, the majority of states do need to submit state plan amendments to implement this change, but there are a handful that do not. And so South Carolina and Missouri were in that category. And so South Carolina in particular has been implementing, I believe, for the last 2 or 3 years, and has been billing specifically for physical health services, eligible physical health services delivered to Medicaid enrolled students. And then there are a handful of states that have state plan amendments pending with CMS, and we're keeping our fingers crossed that those will get approved soon and that those 4 states will be added to the approved category. And then there are a number of states, and I'm sure there are states on here that we're not aware of. So please, if you know there's activity around this in your state and you don't see your state listed up here, we would love to hear from you. But there are a number of states, including Colorado and Minnesota, that are actively moving forward with preparing their state plan amendments to make this change. I will just note there are a handful of states too that have leveraged, have taken a legislative approach to moving this forward. And that varies from actually, changing legislation such as, or pursuing legislative changes such as Florida to change state statute to enable districts to bill, to Utah, which is an interesting example of they just passed legislation last year, or earlier this year, I should say, requiring just key stakeholders to come together to have a conversation and develop an action plan around what this change could mean, and seeing it as exploring it as an opportunity for meeting student health needs and supporting academic outcomes. So it was, I think, an interesting strategy just to get that conversation up and off the ground and bring the right parties to the table to have that conversation. Next slide, please. This is just the same information that I shared, represented in a map. Certainly, if you are in one of these states and you're interested in connecting with folks that are working on this, we'd love to hear from you, and can certainly make connections where we have them. I will also say Healthy Schools campaign for the past few years has been co-convening with Trust for America's Health a national learning collaborative called the Healthy Students Promising Futures Learning Collaborative, which brings together 15 states, some of which have pursued state plan amendments and are reflected on this map, some of which have not, but just to really come together and explore what strategies can look like around expanding access to Medicaid-funded school health services, and then also increasing access to safe and supportive school environments. So there's more on our website, which is linked at the end of this deck, but certainly if you are interested in learning more about efforts happening in your state, we'd be happy to connect you where that makes sense. Next slide, please. So I just wanted to take a moment to highlight what has happened in Michigan, since I think it's a really nice example of kind of how this change can unfold. Michigan actually passed state legislation at the end of last year, which allocated $31 million to provide licensed behavioral health providers in schools for general education students. So really recognizing the need to be delivering more mental health services in schools and allocating funding specifically to bring those providers in for general education students. That legislation also required the state to amend their state Medicaid plan to implement the free care policy reversal. So really seeing this change as an opportunity to bring in sustainable funding for this work. And then they also, as I've mentioned, added a host of additional providers that are now, this change will be implemented in October. So these providers were not previously able to bill Medicaid for services, eligible services delivered to Medicaid enrolled kids in schools, and now they will be able to. So I think, again, in line with certainly the focus around expanding access to mental health services, they saw this as an opportunity to really look at who was delivering services within schools that was not currently able to bill, and then change that via the state Medicaid plan. And they just had that approved in August. So just to wrap things up, next slide, please. In terms of the key questions to ask in your state, these are pretty high level, but I think just help walk through, how to think about some of the key information that you can gather to explore what this opportunity either is happening in your state around this opportunity or could be happening. We really encourage folks to think about what the unmet student health needs are within your state or your school district. In part, I think that can just play a tremendous role in making the case to the state about why expansion of these programs is important, but it also can go a long way in terms of informing when you get to the point of changing your state Medicaid plan, thinking about those additional services or providers that you want to be adding. Certainly taking a look at what is currently being delivered, and then if your state currently allows school districts to bill for those services, and if they allow them to bill, districts to bill for services delivered to any Medicaid enrolled student. And then understanding if your state needs to make a change to implement the free care policy reversal, and really thinking about opportunities to bring other partners to the table to support this work. And then I would just say also, we really do see this as a chance to align this work with existing state commitments around student health. Sasha mentioned chronic absence, which is an excellent example with states, having increased accountability around addressing chronic absence. There's also, state policies and programs around school climate, around nutrition, around physical activity. And I think, this does present a good chance to really align with where, your state's commitments have been around student health and wellness, and really lifting this up as a strategy to uphold those commitments, in addition to expanding access to health services. So I will wrap up my portion then. Next slide, please. And now hand it over to Donna Mazik to close us out. Donna is Executive Director of the National Association of School Nurses and has been with the organization since 2011. She's worked as a nurse in community and public health settings for most of her career, and began her career in school nursing as a school nurse in a high school and subsequently in an alternative high school. And for 13 years at the Maryland State Department of Education, Donna provided consultation and leadership to local school health services programs and state agencies. Donna's passion is to facilitate student health and learning by advancing school nurse leadership and skills development. She's been a fantastic partner for us in this work. We are so thrilled to have her today, and just greatly appreciate NASN's leadership around this work. So Donna, I will go ahead and hand it over to you.
Thank you, Alex. We've heard a lot today, and I think the key words are seizing the opportunity. There is a sense of urgency around especially school nurses and other school health providers in supporting Medicaid in schools. I know from the school nurse perspective, we hear that school nurses are seeing the inequities and challenges that students experience with social determinants of health and health conditions that can impact school attendance and their educational attainment. And there is a way to support those general education students who are insured with Medicaid getting the health care services they need and decreasing the amount of education dollars used for that. Next slide, please. In 2016, the National Association of School Nurse, NASN, introduced the framework for 21st century school nursing practice. This student-centered framework really shows us evidence-based school nursing practice that's really compatible within the context that students are living and learning and playing right now. This framework is aligned with the whole school, whole community, whole child model. It's a collaborative approach to health and learning, and we believe that students covered by Medicaid need to have the opportunity to get the fullness of what can be theirs in a school setting. There's data in the next slide that tells us that students who've been covered by Medicaid actually have better health as adults, so we don't want to hold back on what could be helpful to them. Why this should matter to school nurses is that school nurses care about the students who are in their schools, and they oversee school health. As NASN President Lori Combs says, school nurses are population health gold. School nurses are looking at the health outcomes for a group, and those are students in schools. You see before you some of the skills that school nurses really need to do this 21st century school nursing practice. And for this cause of paying for health services through Medicaid, leadership and community/public health take a front seat in the skills that we are looking at developing more strongly in school nurses, the advocacy, being change agents, looking at funding and reimbursement in the school nurse role, being involved in healthcare reform as well as education reform, policy development, and also being able to work with others to solve that access to care issues and health equity. Next slide, please. We, NASN commissioned a study, a workforce study, and we learned that the primary funder of school nurses are educators. That's not a surprise to most of you. But we see right now in this day and time an opportunity for sustainable funding for healthcare that happens in schools through healthcare funding in this Medicaid free care reversal, rather than leaning on education dollars. Next slide. Here's a picture of what the study that we commissioned shows about Medicaid reimbursement in public schools. We heard already today that public schools are accustomed to billing for Medicaid, the billing that comes from either administrative claiming or that comes from IEPs. We believe that there's this opportunity that we want to increase in all areas, urban, rural, on all school levels, and in all areas of the country, providing students with what they deserve and they need. This next slide really helps school nurses look at being able to share why school-based Medicaid. Well, it's a student issue. It's about student safety. It's about student equity. We know the triple aim of better health, better care, and lower cost is something that belongs to students too. And so free care policy reversal opens the door for these expanded health services for students by increasing the health care providers like school nurses, like school social workers, school counselors, school psychologists, physical therapists, speech language pathologists, being funded by Medicaid dollars and thereby providing for the health of student populations. In this next slide, we want to give school nurses and any school health provider a call to action. What can you do related to Medicaid in schools? Well, on 3 levels, there is work that can be done. We heard that on the national level, there is work happening in this collaboration, Healthy Students Promising Futures, and you can go to that website. Alex mentioned it, and you'll see it again. But stay aware of what's happening with Medicaid and school health progress. It may not be happening in your state or jurisdiction right now, but it's coming. It's there to be had, so you want to be able to know what's going on in your state. On the state level, with free care reversal, there is a lot of conversation happening, and sometimes there's limited conversation happening. The biggest question that you have is what is going on, and be in that conversation. A seat at the table, yes, but also your voice to speak for Medicaid-funded school health services for eligible students. Questions like, what does your state Medicaid plan allow for? Are school nurses recognized as qualified providers in that state Medicaid plan? What services are available to be reimbursed in a school setting? These are topics that you'll want to know at the state level. You'll want to know what conversations are happening, because that map that you saw where things are happening, that's going to change moment by moment, it seems, because now school districts know, states know there is another way. And so be at that table, be vocal. In this next slide, we're talking even on the local level. Be vocal about why Medicaid in schools promotes student health and learning. It's really not just about the positions that will be increased because Medicaid funding enables that. It's about the students getting what they need. And we all know that students need to be healthy in order to access their learning. So tell that story and talk about how Medicaid would make a difference. Be present even in the school district discussions and the plans for Medicaid funding. We hear that in, for example, random moment time studies, sometimes school nurses or other school-based health providers haven't been told why that matters. Why is it being done? Keep your ears to that conversation and find out why a time study is being piloted in your school if that's happening. And for each, we heard this earlier, that each state Medicaid plan is unique. So I want to emphasize those key questions. Is there something already going on in your state? Align with those existing state efforts for student health. Look for partners in this work. And in making the case for Medicaid in schools, remember to find out where the pain points are related to unmet student health needs. which affects their education needs, and tell the story about that and use the data so that you can convince others in your on your local level and in the state that Medicaid reimbursement for student health is absolutely necessary. I'll turn it back over to you, Alex.
Great. Thank you so much, Donna, for that wonderful closeout and providing folks with concrete steps that they can take to explore this opportunity in their communities and states. I really appreciate that. Thank you to all our speakers. Now we have a few minutes for questions. I know we've had a few come in throughout the webinar. So please feel free to keep typing those questions in, and we'll ask some of our presenters. So the first question I'm going to ask, I think, is actually going to go to Lena, since it's about the federal-state, how Medicaid is a federal-state partnership. And coming from somebody who wants to know, does the school receive both the state portion of the reimbursement for services and the federal portion, or only the federal portion? So Lena, would you be able to provide your thoughts on that question?
Yeah, absolutely. And then Sasha and Donna, please feel free to jump in as well. The answer is, it really depends on your state. The formulas both for how much the federal government reimburses states for every dollar the state spends, that varies by state, and then in turn, the amount that the state passes down to LEAs to reinvest in the LEAs themselves varies by state. So unfortunately, there's not a clean answer to that. It is easy to look up the state's share of total Medicaid costs. Easier. There are charts that'll lay that out, and how much for every dollar the state spends, the federal government will reimburse. Untangling the pieces about how much money comes back to the LEAs is a little bit more complicated, but as states pursue moving forward with the free care expansions, as states pursue streamlining their processes, both Sasha and Donna touched on this a little bit. You know, there are some opportunities and some real imperatives to figure out how that works and to make it a little bit cleaner and more transparent. So I'm sorry it's an unsatisfying answer, but I think you'll find that's the Medicaid story, is everyone's a little bit different. Anyone else have other things to add? I think that's all I've got.
Yeah, I would just say
Nothing on my end.
the districts have to. The districts have to put forward some of the money themselves. So they get a portion back. So it's not like they're getting everything back. But the state can, depending on the state may also take a little bit of a cut of the reimbursement the districts receive back from the feds, just for administrative kind of processes that they help with. In some states it's just 1%, in other states it's a little bit more. But it's still again a very useful reimbursement stream, even if it's not necessarily a high match that you're getting back all the time.
Great. Thank you both so much for sharing that. I know we're having quite a few more questions come in, and I apologize that we are at the top of the hour. We'll do one more and completely understand if folks have to jump off, and then we will certainly, please keep sending in your questions, and then what we can do is we can follow up via email for those questions. And my contact information is at the end of the webinar, so certainly feel free to reach out with additional ones. But one more question that we have is just wanting to better understand what are some of the common barriers that states are running into around implementation of the free care policy reversal, and then I think just more broadly, school Medicaid in general. So Sasha, I know you spoke to paperwork, And Donna, I'm sure you've heard, challenges around school nurses, implementation of the program, but just would love to hear from the speakers about what folks see as some of those common barriers around expansion under free care and then school Medicaid more broadly.
This is Donna, and one of the things I heard really clearly about implementation is that a rollout was postponed because the communication regarding the changes that would be happening, that would be welcome changes, really required including everyone involved, and that took some time. So one of the barriers is literally including all stakeholders early on and regularly, so that by the time the policy change is made, that implementation will not be a surprise.
Thank you, Donna. Sasha, Lena, any other thoughts on common barriers?
So this is Lena. I think there are a number of challenges that states, both the Medicaid and the education side, and the LEAs face. Donna outlined the communication. I think inherent in that is communication and education to providers. I think there are issues with parental consent and data sharing. They're all overcomable problems, but do need to be addressed. I think we are up against the hour rather than talking about the ways states have dealt with some of these common challenges. I will say that if you think about all the different problems, a lot of it does get to the communications piece that Donna lifts up, but not just how we talk about it, but who talks about it and how they talk to each other, and the interagency component and the need to bring the stakeholders together. The common barriers that are faced can be solved by talking more, learning each other's positions and languages at every level of a state government. And I think while there are barriers, there are also ways around them. And states have successfully done that, and that's probably a conversation for another time.
Thank you, Lena. And Sasha, any closing thoughts?
I would just say, in terms of other barriers, making sure that the providers you're working with are qualified under Medicaid. For example, in some states, you don't have school psychologists that are qualified providers, which can be really problematic because of just how the licensure works. So, and how Medicaid defines a qualified provider. And I hear that frequently from folks that, they want to participate in the Medicaid, they want to expand services, but they don't have enough qualified Medicaid providers, either because of the geographic location where they are, there's a shortage of providers generally, or they just, the folks that they have who are able to provide services, aren't eligible for Medicaid reimbursement. So that's a challenge, and shortages generally are a challenge in the school space as well. And outside of paperwork, I would say those are the two pieces that I hear the most about in terms of implementation of the Medicaid program.
Great. Thank you so much. And thank you to everybody for taking the time to join us today. On the next slide is my email address, in addition to some links for additional information. We'll be sure to get these slides out to everybody. I want to thank all of our speakers again, especially to Sasha from AASA and Donna from NASN for taking the time to join us. And thank you to everybody for giving us an hour of your day to hear more about school Medicaid. We look forward to being in touch with the recording and slides, and hope everybody has a great afternoon. Bye.